I am. I'm here with Heinz Whites, which am I pronouncing it right?
Yeah,
is that
yeah,
right? What
sounds right.
I'm sorry.
Pomez, actually.
Yeah, I'm here with James Waits, who's a social worker, and now is going to start part time at Taproot. We're going to get into his specialty. Um, yeah, I don't know what is it. Have you ever seen the Oliver Stone like Alexander, where the accents are just like the actors are just going crazy, and Angelina Jolie was like weirdly miscast as a Macedonian, like her choice for ancient Macedonian, which is just pretty similar to Greek. Like it's not that, it's just to roll every letter.
Oh yeah.
The so the whole movie she's just in the beginning, and then there's like flashbacks to her or whatever, but just every scene with her and Alexander is her just being like, never will there be an Alexander like you, Alexander the Great. You're like, wow.
Huh. She
Oliver
used all her
Stone.
R's. Right.
Yeah, Oliver Stone. I wonder how he's doing. I heard his JFK movie turned out to be true. Did you hear that? Is that right?
No, I don't know.
I'm just teasing. I'm just making a joke. When we have like a lot of the bigger guests, I feel like there's kind of like an arc in the middle where everyone's kind of uncomfortable.
Oh yeah.
So if I ever get like a college professor or something, I'll just do like a cold open or something where they're just laughing before I hit record. So they're kind of like, oh, so they're just coming in and like, all right, like, and it just looks a little more natural. Yeah. Like with James Matthew or somebody, like right before I hit it, I'll be like, yeah, I mean, you wrote all this stuff about the Aztecs, but like, how do you know that? Were you there? I mean, you just making that up.
Wait, are you saying I'm not a big speaker?
Yeah, they're like, what?
I'm not a big guest.
So we're talking about doctors, MD burnout, and healthcare. I mean, so James's specialty is going to be taking care of, and this is, your specialty is interesting to me for a lot of reasons that don't get talked about in social work school. But like he wants to talk about the way, or he wants to treat like when MD, and correct me where I'm wrong here, like MD fatigue, the stress of preparing for medical school, residency, and those big complex systems, and also, a lot of your skills apply to academia, high performance executives, people that are operating in a sector where a whole lot of balls are bumping up against each other. There's a whole lot of things that they have to be aware of all the time. And then just the long-term kind of fatigue and strain that does, especially when those systems change or are in the middle of changing, like maybe healthcare is. I don't know if you got a couple of jumping off points there. Is there anything? I'll just hand it over to you. How do you describe what you do?
Yeah, no, that's perfect. Yeah, all that plus just any type of just healthcare worker and mental health kind of aspect. We don't talk about that in social work school as much. I kind of want to tell a brief story about how I got into it. Basically, back in 2019, I went to a training. It was a compassion fatigue training out in the Red Barn in Leeds, which is awesome. It's equine therapy. It works with kids a lot, but they're partnering with JC Duggard.
I thought equine therapy worked with horses.
Well,
I'm sorry. You're gonna just have to roll with it.
Oh damn, you derailed me.
Go ahead.
Already. So yeah, JC Duggard. I don't know if you're familiar with that. You probably know more about that than I do. Which she was kidnapped as a kid in like 1991. But during like my first year in college, she was rescued. I mean, that's 18 years later, I'm pretty sure. Yeah, 2009. So anyway, so she's rescued and, she got rehabilitated and back into everything. I mean, she had 2 kids and she got reunified with those kids over time. I mean, there's a lot of trauma, obviously, that had to be worked out there. But now she turned to kind of like, basically, her foundation has a lot of aspects of like reunification with families and children and parents and that type of trauma. But this training was here, she came to Alabama and we were working on compassion fatigue specifically with law enforcement, mainly because I remember she telling us that like the biggest issue coming back when she got rescued is how many people were like not on the original case anymore. They just kind of, it burned them out. I mean, it's like searching for, 18 years. You can't imagine one cop sitting on a case for 18 years and how much, like, how
that's how it works in movies, and True Detective or something. The guy is just skinnier and smoking more cigarettes and his wife's left him. And then, year 20, he solves the case. But I mean, realistically, I mean, these people can't do that,
Yeah, I mean,
The
they burn out, they get and so and then but that creates so not only is that initial burnout pretty bad, but it creates this thing, compassion fatigue where they just don't wanna do anything else. I mean, they just go, s you know, status quo, mediocre, like, I just want easy cases, or I want out of law enforcement kinda thing.
Mhm.
Um, we weren't there specifically because I had compassion fatigue at the time, but we were learning kind of just the ins and outs of how to be more aware of it. And so that compassion fatigue got me thinking a lot of like, holy crap. Um, I'd spent a lot of years in community mental health, and I can see where this applies across the board.
Mhm.
So, um, and then obviously transitioning over to, big, hospital work and things like that, you see that all the time of the system that we're kind of set up in kind of like ruins us. I mean,
Yeah. Yeah.
uh, it ruins kind of like I think it takes away your passion.
Mhm.
And I unfortunately I witness med students who are not even in residency just feel so bummed about the world because of what it's already set up for them.
Yeah, yeah, that is I'm glad you're getting into everywhere that I what I see on my end, because you've been in a hospital,
Yeah,
so, like, been in therapy, but, I mean, that does seem to be the thing, and, like, I'm not a conspiracy theorist and that I think there's, like, a guy in a back room smoking the cigar, moving the chess pieces, but I do think a lot of things that are bad about the systems that we inhabit that continue to get worse are sort of allowed and enabled because they're useful for the system having more control and more money and whatever, and just so many of the changes with healthcare, like, the amount of paperwork that doctors have had to do. There was I was like listening to some clip yesterday. Somebody was saying it's gone up over like 350 times or percent, 350% more paperwork that you're expected to do around all these sectors, especially insurance. And I think he was in family practice. But I believe that because it's like we have all of this insurance stuff on our end where claims aren't paying, and we're having to go and we're having to call and see what's up, and the insurance company's like, well, they haven't seen a primary care doctor this year. We don't know what their cholesterol is, and it's like, well, why do you need a referral from a primary care doctor if you were sexually assaulted and this person's in therapy and there's a time limited thing? And but it's just another hurdle that they can throw up, like the health screener or whatever, that the more people who don't do it, the more money that they make. And now healthcare is getting pinched, insurance is getting pinched. There's not as much room for middlemen. And their answer is to throw it to doctors. But I think a lot of people get angry with their doctor because that's what we hear from patients is people are like angry. Why would I have to see my doctor? It's like your doctor had nothing to do with this, unless they work, in
yeah,
DC. Like they're not, but people are pissed, basically, they have to go, which I think when people that you're interacting with are hostile or think you're part of the problem, even if that's erroneous, that also does some psychic damage there, if you wanna use D&D language.
yeah,
Yeah.
yeah. No, and it sucks. It mainly because the fact that they're learning this system that they don't know how to get out of it, and there's really no way out of it. And I sit on a teaching team um, at the hospital, and I kind of give basically a talk every week about you have to push through in this aspect. Like this is something you can't control, and kind of get them back to where they do have control, which is taking care of patients, better and having,
Mhm.
these things. And they actually learn through that of like how their interactions with these patients and when these patients get better, that brings them back to a good spot. But then, at the end of the day, it's just like crap, there's nothing left for this. We can't offer anything more. We can't do this. Like what was the point of today if tomorrow is just going to suck?
Well, and I think that the amount of bureaucracy and BS and that you used to be allowed to get away with was self-limited for
Yeah.
MDs by the fact that they could just leave. They were usually people who were bright and upwardly mobile, and if not, had the capacity to be and could say, "Okay, I'm going to go do something else." But what we've done now is we've saddled that process to so much money that there's no one who has it lying around, even if you are incredibly wealthy. So you're under all this debt that you've
Yeah.
already taken out, and now that filter of how much basically you can abuse the system can abuse these candidates is that filter is removed because I just borrowed $300,000, and unless I finish this thing, then I have no hope of ever being able to pay that back. And that seems like a scary development to me in the way that those systems are run.
Yeah, they're locked into it pretty much. I mean, I just had a conversation with one med student the other day, and they're just thinking like, after I go through med school, I don't even know if I want to enter residency. And I'm like, why? I mean, how are you gonna make back?
Yeah.
Yeah, you got to do something. I mean, you can go. I don't know what they could do after that. I mean, they become MD after, but no, I had to sit down with them. I was like, no, you just pick something, find a passion. If it's not this or that,
Hmm.
then make back your money, or you're always gonna be sitting in this place where, um, yeah, that debt is wild. Um,
Yeah.
but what I'm seeing is even with mental health workers and things like that, we're creating these like robotic entities of people, not necessarily shells of people, but they just are so routine and so like accustomed to this bad system that they
Well,
don't want.
empiricism connected to no humanity, no soul, no anything, I think is another one of those things that just gets it's not like there's one guy doing it, but it does benefit a lot of entities and it has kind of gotten out of control. When you're saying that it almost like breaks candidates, is that what you mean, or are there other ways that happens?
No, that's it. It's just it. They fall into the trap, like you said. They just kind of like go throughout the rest of their life, not really exploring how to regain their self inside of it because they don't
Mhm.
feel like it's worth it, right? Um, because the more and more you branch out and try to regain a passion, there's always something that brings you down again. And that sounds so terrible, but that's the whole point of this is that we have to being in a burnout mode isn't bad.
Mhm.
As long as you process it, and try to get through that and figuring out what actually is. And I want to, yeah, basically say that like being in burnout isn't mean, it doesn't mean you're a bad person or that you suck at your job or that everyone else around you sucks. It just means that you're just in a spot where it's like a life cycle, there's some death and rebirth at the end of that.
Well, and
Um,
I think it's a way of burnout is maybe a gentler way of thinking about it is that because it does, yeah, it doesn't mean that you're acting incompetent. A ton of people are like, well, I'm not burned out because I'm not acting incompetently. I'm still doing my job well. I'm still functioning. And it's like, yeah, that's great. But burnout is describing that you're coming in through it in a way that is not sustainable,
yeah,
So like while you still got a little energy left, let's figure out a plan to make that sustainable. Could you go through just like practical tips or techniques that people that you would use with somebody who's in academia, who is an MD, who is an executive, who is in healthcare, and they know that that's them, but they're also sitting back and being like, yeah, I've read some books, I've read some podcasts, I've heard some podcasts, and I know what CBT is, I know how CBT works. So like, I don't want to go into therapy and make a list of my emotions and point at my emotion on the pillow, or um, you know,
no, yeah.
what can you do to help me?
Yeah, so obviously the mindfulness based stress reduction kind of things. I think the first is defining it, like in processing the actual burnout in itself, right? I think if we, what I see a lot. Sorry, I'm going off, but
No, no.
um, what I see a lot is we start kind of like treating symptoms of burnout and not necessarily the actual burnout,
We
right?
treat people operating in an unsustainable system with a kind of treatment that also is not sustainable.
Yeah, like let's say, if I just work out 5 times a week, my stress will be reduced. If, I have low mood, if I start changing my diet, and I'll, change my diet, drink less, right? My mood will improve. Well, those are healthy things, but like you're not processing what's actually causing those
Hmm.
things. Much like, anxiety and symptoms of trauma after that. We tend to just focus on the symptoms, but not actually the root. And so in getting back to that self of like centering, like it being accepting that it's okay to have burnout, right?
Hmm.
Getting that's the first part, is that acceptance, and then running through and having sustainable plans of how to prevent that and reduce your stress. Is it meaning that you can accept one thing at work and then try to do something differently? You don't have to change everything all at once, right?
Hmm.
Um, and basically having a good plan in place to kind of recognize like your symptoms of burnout, whether
Hmm.
it's or compassion fatigue, whether it's somatic, symptoms, or you just feel angry all the time. It's being able to recognize those things. And I think we're not, obviously recognizing that type of symptoms in our life. Like we we kind of are appalled. We're like, oh, I'm just so mad. Well, how do you get rid of that anger? Um, and if you don't know the root of the anger, you're never going to get rid of it. So those obviously CBT, things like that are really good, because you have to change. One of the things is you have to change your thought process on the system kind of thing, right? And being accepting that your system may not change now, but when you redevelop and find yourself and find your passion again, you're your current change. Um,
You said that just defining the problem. I'm thinking of the Joseph Campbell's, the hero's journey or circle wheel or whatever. I think Dan Harmon calls it that. But the first that just naming your pain gives you power enough over it to begin to heal. The perspective itself is healing.
oh yeah, absolutely.
Like Umberto Eco, I think that's him. In the Name of the Rose says something about like blessed are the poor for like at least the rich have the language to know who their enemies are or something like that.
No, well,
And
that's
it
across
just
the board of just naming things in general gives
yeah.
us power. Yeah.
And what I see, because I think I see, I've got a couple MDs, but like more kind of like executives I've seen, and they're thinking that there's going to be like the therapist who's like 22 who graduated from like the mom and dad paid for college and they have no life experience and they went straight from the sorority to the like small Christian master's program, and now they're coming out and they're just learning how to like decorate an apartment, and somebody who has an enormous compromise that they're making all the time with like wealth and power and systems and all this stuff is going to come in and just have no capacity to be understood, and that's what they're afraid of. But there are therapists who have backgrounds in these things, like you and me. I don't have your background, I have a different background in psych, but like who can say, oh my gosh, yeah, the system is changing so much. Like the world that you thought healthcare you thought you were going to be in when you were going when you were a kid is not there anymore, and now you're starting to accept that and grieve that. And where do you think it'll be in 5 years, and how can you prepare for that? Just somebody who can have that kind of conversation and systemic perspective is like something you can't see when you're just in it all the time, and it's like too scary to look down.
Yeah.
And the conversations I've had with you, like it seems like that seems like it might just be most of what changes in the first session is that somebody's like, oh, you're right. Like I'm allowed to think this, I'm allowed to see that, I'm allowed to label these things.
Yeah. No, yeah, it's I didn't think talking about basically burnout and compassion fatigue, you would think that that would like ruin me, just hearing all of the problems of the system. But uh, I don't
Every
know.
system has problems. It's not like we're not saying healthcare is bad. Get out of
No.
it. People still have to be doctors. People still have to be, it's understanding them, and
Yeah, and
anticipating it.
it's giving a safe space for it. I mean, just imagine, especially in residency, when you're not an attending yet, and you have to. Who do you complain to? Or not complain, but who even reach out? Like if you tell all your cohort or your attendings that you're facing burnout as a resident, what can that do to you um as a person? Like you wouldn't want to do that. That kind of closes some doors for you.
Well, and it's political too, in a
Yeah.
way that you can't be terribly vulnerable with the people who might understand what you're talking about. I mean, I think academia is lonely for the same reason. Is that it's like, okay, let's take all the people in the world who know enough about this teeny tiny little thing, area of oncology or, like medieval texts or whatever, and then we'll put them in like, and then we'll make them all compete against each other. So
Yeah.
it's like everybody who could be my friend, man. I'm kind of, like that's the thing academics navigate. Healthcare is political in a different way. There's not that kind of direct competition, but yet you can't be super vulnerable. I mean, you're kind of a politician in a hospital.
Oh yeah. And then the you get kind of paranoid because the moment that you feel like you're um that you feel this certain way, you feel like somebody's going to step over you to get ahead because they're saying, well, they can't handle that right now. They're in a bit tough space. And that's not and that's not everyone that I come in contact with, but you can just imagine, yeah, the political nature of everything of wanting to succeed. You're not in your peak of your career just yet. So you have to gain, you're still gaining and you're still trying to win.
Well,
Um,
the social work thing is kind of, like you go to school, if you have a bachelor's, then the master's degrees, 2 years. and then you get out of it, and then you have to work for something. You can't take insurance. You're not very useful, or you're not very profitable. So you're working in these places that have a lot of problems. A lot of the more toxic people never get out of that level of practice. And the first 2-3 years of social work practice is like pretty chaotic for most people. And then you can get the LIC and you can get out. But that is draining. Like I work with a lot of social workers and just preparing for like how to do it, how to go through it, to know this isn't going to last forever, to stay motivated, to study for the LICSW so you're not there for 6 years.
Yeah.
Like we do that a ton. But for doctors, I mean, that's almost a decade by the time you're going through school and resident. I mean, you don't even know who you're going to be on the other side of that. And I think therapy is indicated when you're going through a change where you forget who you are,
Yeah.
or might, lose touch with it.
No, it's a wild, it's a wild party for the MDs. And I mean, like I said, third-year med students don't even know what medicine they're going to be in. I ask them every week, what medicine are you going into? And they'll say, well, I haven't figured that out yet. And it's just like, well, I mean, you're coming close to it, but if they can't even know what profession that they want to pick, and this is not on them at all. This is just, they're still in a spot where they're trying to figure out themselves, and it's really hard to combat. Like, I'm trying to figure this out, but I'm also burning out at the same time. Like, so it's sad. And like I said, it's not just them. Like, yeah, it is academics and even, mental health and social workers. I mean, they do have those rough jobs. I mean, I experienced it with community mental health. I mean, it's great, and you do learn a lot, but when you're stuck because the person that you're helping is limited by a parent or something like, I worked with children a good bit.
I couldn't do it.
Yeah.
I couldn't do it.
Well, I loved it, and I still do. I'll revisit that. That's part of my burnout is, I'm taking some time and realizing that I had to take a break. One of the biggest things in community mental health and children's services was that these children get better, but as soon as like the parent stops engaging with that type of work, kids don't get better. And seeing that over and over again, really takes a toll on you. And so I've sat back, I've just kind of said, I'll give it some years before I revisit children, and working with them. And I'll still work with them now, but like on a small, tiny basis. But it is.
When I was doing individual therapy, and they kept trying to put me with kids because I was male, and there's a lot of people that there weren't very many male therapists at the big practice that I was at before Taproot. And so like I was talking to one of the child therapists when I finally was like, do not give me another teenager. Like I can't do it, because they would always be like, no, there's no family problems with this one. It's fine. It's a wealthy family and they have this, he's just having a little trouble, whatever. And then I'd be on the phone with the HR until 2 a.m. And then the case would blow up. And then of course they're not going to come back to individual therapy or something. And I was talking to one of the child therapists, and I was like, cause all he did was trauma with children. And I was like, look, I can't do this. Like, I can take a 40-year-old and say, let's go back to when you're 12. And when we go back to when you're 12, let's heal that. Right.
Yeah.
But I don't want to take a 12-year-old and say, all right, yeah, let's do Zen mindfulness. And I'm going to be here with you. And I love you. And I care about you. But you're just going to have to go back into this house where these problems don't change for the next 6 years. Like, I can't do that.
Yeah.
And he was like, oh, I love that. He was like, that's why I do it, is because I get to be there with him. And it's like, it was wild. I realized like so many people have different skills than me in that conversation and are looking at things from this different angle, as I was trying to solve a problem and he was trying to be there in the middle of pain, that he couldn't change. And I think I'm much more, I don't know. It was wild, but
that skill set. I'm so glad we have such a diverse kind of like skills across, therapists and social workers and things like that, just because I'm glad that some people enjoy that type of work. But I wonder, I haven't met anybody who has said, oh man, I'll work with kids forever. Right. And I'm waiting. I mean, I'm sure there's somebody out there. I just haven't met anybody, and I really want to pick their brain of like, why. And there's some great people who, especially the kids who kind of need a lot of work. I mean, there's some kids who come out on top, and to this day, I have clients that I saw 8 years ago that are 24, and they're 16, and I see them, and they've done really well, and and I've asked them, you're doing well, how, why, and or not why, but we've worked on you for a long, and I got out of the house, or I left, I went to, and that's just, I mean, that's wild. I mean, just think when you're working with a 12-year-old, you got 6 years before you have the opportunity. to leave the house kind of thing.
And I liked family work. I mean, when the whole family's there, which,
Oh yeah.
Becky Milstead at our practice does that, and she's really good at involving the family and getting everyone to communicate. But it's like when you have like the parents are like, I don't know how to do this, or I want to understand what the child's emotion means, or how can I do a parent plan? That's a whole nother thing. I mean,
Oh yeah.
when I was doing it, it was someone was bringing a child to individual therapy and basically being like, make them stop doing this. I'm going to change nothing. And it's like, well,
Yep.
you're the kind of the reason that he's all right. I don't know what I'm supposed to do here. Like, it wasn't for me. When the family wants to change, that's wonderful.
Yeah.
But I think
Absolutely.
too many of especially like the child diagnoses. Well, I mean, no, the whole thing, but it affects children in a different way. We've moved like, especially even like the DSM has moved further away from the ICD-10, 11 because it wants to concentrate on how Americans want to do research and not really like what the symptom is, but just the way we want to conceive of it or is useful for our system to conceive of it. And part of that has just taken away the focus on the environment at all and tried
Yep.
to be like every symptom is just sort of happening genetically or bacterially in somebody's head. And with the child diagnosis, I can't even read some of these new ones that got added with the DSM-5. You're just like, they're like, oh, the child totally not the parent's fault that it does that disorder. And you're like, what?
Yeah.
Like, why did you add this? Yeah, I don't know. So, can you say anything about like those systems, like the way that we don't really want to critique an environment, but we put more and more responsibility on an individual, like in a way that's breaking healthcare? Do you see that? Like, I don't know if that's relevant to stuff that you see.
Um. Actually, say that again.
Like the way that I think it's like useful for healthcare to put more and more like responsibility that isn't fair on the provider to like fix an environment that they have no control over,
Oh yeah. I mean, that's the thing. So, for instance, yeah, I see that all, and that is relevant. Mainly because there are really good docs, and I don't think they're in burnout. But let's say a trauma surgeon, um, they have 3 days to basically discharge a person from their bed,
Yeah.
and and you're talking about a wide range of trauma, physical trauma that it could be a gunshot wound, it could be someone that has 90% burns, but the way that their system is set up is the insurance is just like, we need that bed in 3 days, kind
Yeah.
of thing.
Yeah.
And
And that isn't the doctor's fault as an
no,
individual, you know?
no,
It may
yeah,
be the AMA's fault as an entity made of doctors, but that isn't this one person's
no,
thing,
it's insurance as well. And so yeah, it's not that doctor's fault, but that doctor has to do. I mean, they can stretch it, but I mean, there's incentives for that 3A rule kind of thing.
Mhm.
I'm not entirely sure how it works out, but then again, if they're medically, clear, it's just like, well, they can discharge home. Well, are you discharging a, person without a home to the streets with 90% burns? Like that's wild. And our system in our state is not set up to really help out that population. And I say that all the time. Is like, we can't, I say this, you can't think about this because you can't work harder than our system allows, specifically the state system.
Mhm.
There's literally no resources for that type of population. And so, yeah, and that's out of their control. That's not even part. I mean, that's Alabama politics at that. And I say that all the time. Why don't we just march down to Montgomery and try to fix it? Well, backlash, uh, I have conspiracy theories on that. And I'm not talking bad about it. I mean, I love Alabama. It's just we are, I wish the awareness there for those types of interactions need to be seen. I mean, because that puts a toll on all these, whether it's nursing staff or it's the social workers working these families have to figure out, oh my God, like this
Mhm.
patient's ready to go. What do we do?
Well, I think politics is used more of a scapegoat than a solution. I mean, I'm
Yeah,
like thinking of all the stuff that like happens on my Instagram. It'll just be somebody will like film a homeless person in like California or Portland, and then be like, "Ugh, Democrats do this," and you're like, "I'm in a red state, man. You want a video? Like, what what is your solution to this? It doesn't look like anyone's doing much."
yeah.
Um, so
So
yeah, I mean, I think the politics is something that is bipartisanly. Um, uh, not effective.
and and a lot of my colleagues, I mean, they get to the point where, if they try to, stick their neck out and try to give a different alternative solution, I mean, they're they're like hammered down, like, no, that's not no, we
Mhm.
can't keep this person 2 more days. No, you got to figure out a way to get them out. Especially our social work colleagues at UAB. I mean, I I sorry, I can't, the hospital workout. Yeah. So
It's on you, man. I don't work there anymore.
I love it, but it's just
Yeah.
like there's so much there that they do work hard and they do try hard, but they're, I mean, it's expected of them to like get this person out, get them to do this. But if
Yep.
they can't, it seems like it's that social worker or that that
Mhm.
case manager's problem, but it's not. I mean, they're literally hands are tied behind their backs to where they are, and that gets a lot of people into that space of just like, then this is nothing. I don't care about, not necessarily I don't care about the person anymore, but like if this is all we got, this is all we got. And
Yeah.
like I said, that robotic, they just one track mind and just keep going, right? They
Mhm.
just do what's asked of them. I think that culture is changing at the hospital, with having to realize that we have a little bit more power to say like no. um, and right now there's not like to say no to like bad plans. And I have to kind of like walk people through those plans of like what's better, what's better for the patient, what's better for you. Mainly because, yeah, I don't know, my colleagues, they endure so much. It is, I could, that's one reason why I want is awareness to burnout and compassion fatigue, just because the system and where we are, it's a great place to be, but I mean we are not immune to that type of
Well, and I
burden.
don't think that a lot of the problems that you're talking about are unique to something that UAB is doing, or that even healthcare at this point is doing. I mean, a lot of this stuff you can read stuff from the 70s or the 40s, and the bureaucratic insecurity is the same. It's like, because the bigger and or what's there's like a joke that we always make about how, like, they put up the posters in the school that are like, don't take our word for it, think outside the box, like, never stop learning how it actually works. And then if you do any of the things that are on the posters on the wall of the elementary school, like, you will be an alternative school, like, you have to put it on the poster, but like, don't do that, kids. And the hospital is kind of the same in that the bigger a bureaucracy gets, like, I'm thinking of, I really like that HBO Chernobyl show. It was like
Oh yeah.
really good. But you get that sort of like end of the USSR insecurity of like, but you're saying, yeah, you make a very good point and you have lots of evidence, but you're saying that the party is wrong, and the only problem is the party can't be wrong. So you must be in trouble.
Hmm.
But you get that where it's just like, I remember being in these meetings that they would make us go to that would go on forever. And they were like, we really want to have a solution. We really want to do things different. We really want to improve. And we need y'all's feedback. So could you give us some like advice? And but the only thing was, you couldn't say that they weren't perfect, right?
Yeah.
And you couldn't say that something needed to change. So that was the unspoken rule. So I was always like, especially when I knew that I was going to be in private practice in a year, I was always like, okay, if you do these things, doctors will burn out less. You will make more money. There will be less med errors. There will be less staff turnover. And the downside is that somebody might not like that you change something who hasn't worked here for 13 years. And
Yeah.
then they would come at the end and be like, why did you say that? We asked for your feedback, but you can't say things like that.
You can't. Yeah.
And because they wanted, a room full of people to be like, we should have more gumption and more integrity.
Yeah. No, and I've been part of those meetings as well. You try to come up with a solution, and your solution is like kind of the costlier one. And that's the thing too. It's all, I don't want to say it's all about money, but like it comes down to MDs have no control over, and like executives kind of like how the company just functions as a whole. And
Mhm.
it's wild because the solution is hire this type of specialist or do this, or y'all are asking the wrong people for the solutions. Why are you not asking the right people for the solutions?
Yeah.
We don't want to ask those people, right? And then those, I've literally been in 100-person meeting brainstorming a certain topic at UAB, and within 6 months they shut it down. Like,
Well, the VA is kind of notorious for that too, which I think the VA
yeah,
is probably the most nefarious kind of bureaucracy. Is it's like, every time you ever heard, I mean, I remember, you can look up, like, sometimes I'll be Googling something that I want to know. Like, I think the last one was like, I was like, oh, I wonder if anyone's ever applied D&D to PTSD. Like, if anyone's ever said, like, you can role play or whatever. And I
yeah,
searched it and it was like, yeah, okay, here's a guy who's doing a pilot study for the VA, who's had wild success, and they're publishing the paper. and it's like in 1992 or something. And like that will always happen where like, because that particular case is kind of interesting that the people were applying. This might be a fun episode if we could find somebody who does that, but they do like they would take, it was kids, where they would, because it was like family program or something,
Mhm.
but they would take kids that had this real negative self-image and make them do like a team. And D&D, you're describing your action, like Dungeons and Dragons, you're
Yeah.
describing your action. So the kids would have to be like, I get so angry, I do this. And then now they're thinking about emotion and they're like, well, you getting angry and doing that actually just messed your team up.
Yeah.
And then their self-image would change and they would be like, I hate him, but I have self-control, so I don't do the thing, And then like it was like this kind of fascinating thing. But there's ketamine, psilocybin, there's a bazillion kind of brain-based medicine, interesting psych interventions that aren't CBT, and tons of benzos
Yeah.
that have been done. And you can Google the TED talk that the doctor did. And I mean, it literally goes back to like 1985 to, I mean, a ton of them in the 2000s. None of them ever changed the way that the VA practiced medicine. The way that it's done is still CBT and tons of benzos for psych and PTSD. And people getting diagnosed with PTSD, they don't even have it. They're just a little anxious or something.
Yeah.
And so, none of those things that they said we really want to do it and change ever got big enough to do the system, even though it got national news and made somebody's career and had a bunch of publishing and was validated by all the research. So why? Why not? I got the email yesterday, like Biden was like, I want plans on my desk, do a study. There's all this prize money. If you, I mean, they do that every 5 years and it doesn't change that system. Why is that?
Yeah, that'd be very interesting to look into that type of system and versus like a system like UAP. Thankfully we sit on, consult psychiatry, and we I'm glad I'm learning so much. It's like playing House, like the show House. We sit
Mhm.
around this table and like it's consult psychiatry. So there's someone in medical, that is probably having some crisis, and we got to figure it out. And just like going through everything and trying to figure out exactly the problem is wild. And everybody leans on psych for a lot of things, good histories, and hey, make this person behave kind of thing.
And I think hospitals are starting to just take psych to mean like, we don't like what this person is doing, call psych. And it's like, is it a psychiatric issue?
Yeah.
Is it a bit like, what is it? What are the reasons why maybe we shouldn't call all psychiatric facilities and psych services behavioral health care? Because behavior is not maybe the best way to separate somebody who is a sociopath from somebody who has schizophrenia.
Yeah, I mean, from my personal experience, I mean, I had a nose procedure done in 2020, and I woke up from being under, and I was like confused, and I walked out of the recovery room naked, trying to find my clothes. And thankfully, I was still part of UAB, but like an outpatient. Had I been inpatient and did that, I would have called psych and told me to get me back to the room.
Yeah. Drug seeking.
Yeah, like I was so confused. My wife had to like bring me my clothes, and they're like, "Hey, can you just help like get him back into his room?" And I'm just like searching for clothes because I was confused. I don't remember any of that. That was just kind of the story. But
well, I think economically there's economic factors and structural factors, but then also just the way we conceive of psych is changing, and hopefully going back to sort of the way some stuff was, before the cognitive revolution, and that's becoming part of healthcare. But one good thing, I mean, one thing that's maybe exciting if you're a doctor or if you're a resident is like, this system is broken and not working. And so it has to be different. Like, there's no way for this to continue to decline for another 10 years. Like, someone's going to have to come in. Like, we need to be able to build these structures. And like, maybe you are in this place that you don't want to be in, or maybe you are in this place in the profession that's really inconvenient, but that's also really exciting. It's like we just tend to not fix systems until they completely cannot be fixed, until they're completely broken, and we're sort of getting there. I mean, I think that this is a time where the good ideas that we've been able to ignore for the past 20 years, we probably can't ignore for another 10.
Oh yeah, and that's one of the exciting things with psych and these psych residents is I have a couple of them like, I'm tired of like the medication route. We got to find something different, right? And I'm like, hell yeah, we do. Like, yeah, medication can't solve everything in some of these patients. And it's just like, it used to be focused on that type of, this is the only thing psychiatry can do. And you're getting these young residents that want to exit. And
And
that's what
you
I'm
lost people who had capacity to understand healing in another way because you took away every single tool other than pills. So now every tool, if you're a hammer, everything looks like a nail.
yeah.
And you lost all the institutional wisdom of the urban yalams, of the people who could do talk therapy because you turned healthcare into a service. And that service meant everyone's looking at psych being like, what do you do? We're procedure oriented healthcare now. There's no procedure here. It's just talking.
Yeah.
Like we want you to deliver babies and don't cure it because that would be expensive, but just treat cancer forever, please.
Yeah.
That thing made these sectors of healthcare very profitable, and it made anyone wonder why you would go into psych and psych just kind of be chronically underfunded everywhere.
Yeah.
But
And
the more nefarious thing about it to me is that it took these services and made them 5 to 15 minutes long.
oh yeah.
You don't know anything about me, and now you're putting me on drugs that affect my brain,
Well, that's
you
what the
know?
therapists for working 45 minutes are for.
But then the therapists working 45 minutes aren't part of it,
Yeah.
like, you're not pairing even the people who are like, "Well, research went that way or something." No, it didn't.
Yeah.
Research always said, I mean, taking aside all of the things that we made up to make antidepressants look more effective than they were, like, it always said that these things were, in most cases, only effective, and in all cases, almost all cases, more effective when you combined antidepressants with therapy.
Yeah.
So it wasn't evidence-based. Don't tell me that because you weren't saying go out of the therapy office and then talk to the psychiatrist. That isn't what you did, you know?
Yeah.
And now we've lost all of the institutional knowledge of the people who knew how to talk to somebody for an hour in this whole field of medicine. So that's
Yeah.
scary, but also exciting if you're an MD that wants to blow that world up.
Yeah, and that's something that I'm doing. Every conversation that I had is kind of saying like, if you do want that change, you got to be okay with one feeling symptoms of that type of compassion fatigue and burnout, because you're going to run into brick walls with that, right? You want to change right now, but is you can't. You're a resident, and then outside of residency, you're looking for that good job to like figure out, and do you become another cog, in the
Mhm.
system, or are you going to, put a screwdriver in it and try to do something different?
Mhm.
And it's kind of filling those out, but it's like them being okay with some of the, and everyone in general just being okay with some brick walls, and those brick walls come down at some point in time, but it's just when, and it's how to maintain that resilience through it.
It's kind of the serenity prayer of that. How do you accept the things that you can't change and change the things you can? And just having somebody help you go through that. Sometimes it's more of a Venn diagram, like you're saying. Some of those brick walls
Yeah,
come down with time, but we do. I think we tend to beat our head against walls that we haven't accepted are there yet.
yeah.
And when you get in therapy and somebody says, "Yes, you can't do that," but where can you redirect that energy?
Where can you
So many
redirect?
times, that's when things change.
Yeah, I mean that's kind of what it is. It's and we have to redirect the energy to the right things. I talk about productivity a lot. Is everybody thinks like being productive is doing everything all at
Mhm.
once, but it's really just about doing the right things at the right time, right?
Exactly. Yeah, yeah.
And
And no, go ahead, please.
I was to say, and that's kind of the focus on in burnout is like everybody thinks, yeah. So everybody thinks we have to do everything, and this is what we can
Mhm.
achieve. But it's really about kind of picking the right thing and being okay with that.
But it takes somebody with your depth and kind of existential bent to be able to understand that. I mean, I think why a lot of just higher performance professionals that are bright and have already kind of ruminated on these things that are hard and they are paradoxes. There's not an easy solution. They're afraid that they're going to end up with sort of avoidant cognitive only cognitive behavioral supportive counselor that's just like, well, maybe that wall's there for a reason. Well, maybe you should just be grateful for the wall that you're beating your head against, instead of just like, yeah, that's a bad thing, man. That's bad. And it's not going to change. And maybe it will change in 5 years, but what can we do now?
Yeah. What can we do now?
Unfortunately, most therapy just doesn't start there in my experience. It's
Yeah.
people kind of trying to talk you out of your emotion, which seems weird, but
No.
they'll let you
No.
label it, but then you gotta zing away from it.
Yeah. There's so much there. Yeah. Um. Yeah. I'm lost.
So if oh, sorry.
Oh yeah. Sorry. You go
So
ahead.
if you've got, 10 just concepts that a doctor comes in, somebody in one of these systems comes in, it's not an acute trauma. It's not like they're having one thing happen, but it is strain trauma and that there's just too much energy activated all the time. I mean, where do you start? I mean, what are the first 5 things you go through, screen for, do just, practically as a therapist that's treating that stuff.
Yeah. Basically, how much has it affected kind of your functioning, right? And what have you kind of sacrificed in order to maintain what you're doing now? And trying to redirect, basically, how's it affected you as a person, and how's it affected people around you? Does it create, comorbid diagnosis? Are you depressed? How much is your anxiety level, or, rate it, right? But how much are you attuned to yourself, right? Have you noticed how it makes you feel? Like, what is burnout? You have to kind of notice and kind of walk through what that feels like for you, and it's different for everyone. Um, let's see. Yeah, it is different for a lot of people, but really, it is kind of how likely are you to continue on? Like, you have to ask that question. Like, if you're in this space, right? Do you want to continue in this space? Do you want to keep feeling like this? Do you want this to keep going?
Purpose. Why
Yeah.
why are you doing this? Do you remember, or have you thought about that?
Yeah. And then read and kind of redefine your passion. Your passion may have changed from med school to now, right? Let's help figure that out. Your passion is still people. Like, you don't become a doctor just because you want to, do surgery. Like, you're still helping somebody, or just big leagues, right? You have a company, you're passionate about something to grow something, right? Your passion that was there. And then when you start losing it, it's not necessarily, and that's something you have to talk about too. Are you losing that type of passion, or is it just being redefined as you go? And are you okay with that redefinition? And so, there's a lot of, there's a lot of things that you look at and screen for during this, but it's definitely how you are, where it hits you, like physically, right? And then your thought processes. Yeah, there's so much, and like I said, it's per person. It's going to be different every time, because that burnout looks different, and that compassion fatigue looks different to everyone. And it's just talking about, where were you? Was there a time when you didn't feel this way, right? And where you are now, and what was different, and things like that.
Yeah, and just knowing we're allowed to change. Like 10 years is
Yeah,
a long time. I mean, and doctors too. I think that's one of those professions where some people are just told that they're going to do that they're going to go into it, and
yeah,
kind of putting down somebody else's goals, or the family legacy, to say, what do I want to do, is
yeah,
like a big thing that a lot of people start to uncover. I'm really excited for when you start to do brain spotting, and we can go over SLT, because a lot of what you're talking about, it's like, it's so much fun when you get them to notice an emotion, and there is this huge somatic reaction of
yeah,
like, every time I feel this, my back does this, my heart does this, or my stomach does that. And just with the pupillometry, like with the eye movement, that you can just pop that in 10 minutes, and then it's gone, and then they start feeling all those feelings, and come back the next session. I mean, like, that's such a neat thing. It's like one of the reasons why, I don't know, a lot of the stuff at Taproot just like works really quickly, because you're just jump starting, and it's like, you would have gotten there eventually in therapy, but a lot
yeah,
of the brain-based medicine stuff just make change happen so fast. It's really
yeah.
exciting.
I definitely think brain spotting and your SLT is going to be a huge factor in helping people, specifically. Yeah, reaching that part and just kind of unlocking that part of the brain just to get through that, because that's another thing too. Like, burnout could be a symptom of past trauma, really.
Yeah,
I mean, and
reliving that old relationship and not even knowing.
yeah, there's something there, and it's kind of like figuring it out. And like I said, if you haven't named it, like, if you have not sat back and named it, then you'll never be able to overcome it, kind of thing. It's trying to get back to that root, and really do anything possible to kind of really get you to the place where you need to be. And that means going back, or talking about trauma, talking about and getting through it, working through it, processing it.
Mhm.
But yeah, brain spotting is going to be pretty good.
But when you have the training, or when you
Yeah, that's next week, 2
next
weeks
week?
from now.
Oh,
2 weeks
cool.
from
I hope.
now. Yeah,
Yeah, let me know how it goes. And if you want to sit down and play with it for a minute, we always like do consultations, and like play with like tips and different things, because I don't know, it's really neat. It changed. It let me do everything that I was already doing faster,
yeah,
and with very little kind of I don't know. It's not a protocol heavy thing. It's a pretty natural thing.
yeah. And it's it'll be good to dive into and just kind of see where we can expand it. Really, I mean, you don't see it often.
Do you notice that like a lot of physicians or a lot of those kind of high performance personalities like have just kind of a chronic but highly functional, they've learned how to manage it in ADHD or other kind of like complex trauma. There's a lot of disorders that kind of come from a chaotic childhood where there was either trauma or you just kind of weren't getting enough. I think ADHD is one of those things where there's definitely a correlation. And I remember at the hospital, so many of the doctors, like they weren't medicated for it or anything, but it was like their whole board would have post-it notes and
Yeah.
then 16 alarms are going off, and it was because they had just figured out a way to environmentally control this thing. But I think, I would imagine if you're dealing with MDs that you're also seeing a lot of ADHD.
Oh yeah, that, and there's this kind of like idiopathic narcolepsy that I'm dealing with too. That it seems like everybody's getting these days, and it's I think it's linked to kind of like past trauma, and then
Yeah.
and then not dealing with it, right? So
Mhm.
yeah, it's a spectrum of what I do see, and there is like, yeah, there's definitely a pattern there.
Mhm.
So
Well, is there anything that we don't get to, or you feel like is an important part of your approach and how you want to? I don't know. Anything there? Anything
yeah,
else?
no, I'm here to attack everything, right? And it's not just yeah, not just burnout and compassion fatigue. I help a lot with anxiety and trauma. So I'm not, I like it all. I think it all goes hand in hand at some point in time. And so and it's something I'm just passionate about, and make sure that we all kind of get more aware of it, and I'm here to help. So
Well, sounds good. Is there any anything that has to do, not just with your specialty, you think would be like kind of a fun topic, or anything you want to do an episode on in the future in the next couple of things? I'm excited that with because Alice got underwater, she co-hosted like once or twice, and then she got busy. But when everybody's in network and everybody's going, I'd like to have more of just kind of a roundtable, whatever, not have to. It'd be neat to get some different topics and things on the table we all have different perspectives on.
yeah, I listen to your conspiracy ones, and they're so funny.
Matthew Rinsky and them, yeah.
Yes, and
Right.
the cults, and those are so wild. You never think about like just talking about the psychology of those types of things, but they're great.
That was kind of the direction I wanted to do with the podcast and the blog. Like I had no interest in being like, it feels like the two ways that you can do like a podcast on mental health are to be like, all right, gentle friends, remember to eat ginseng under the moon. Or like the other one is to just be like, all right, 10 ways that the government is making your gut inflamed by you not whatever. Also, like I just got canceled, while I
Yeah.
was recording.
Also,
I go,
yeah.
I get a bunch of emails about that one guy. I don't know anything about him. I mean, it looks like the kind of thing where like half of it is kind of like, yeah, that seems like smart, forward thinking anti-establishment medicine that makes sense. And then the other half is kind of like, I don't know, man. Does sunscreen really give you cancer? I haven't seen those numbers. But that like Huberman guy, you know what I'm talking about?
Yes.
Like I don't know anything about him, but I just get emails where people tell me to listen to it and I don't have any time. But didn't he like it just came out that he had like 10 wives or something? What was the scandal?
I've not been that that in depth, but I do know that I did see some
Something he got.
problems.
Yeah, I don't.
Do we want to look it up?
I think he had like a bunch of secret girlfriends or something, and then they all talk to each other.
Sounds like a cult.
I thought everybody that had a mental health podcast was allowed to do that, but I guess it's good.
No, I just have 10
I'm
cats.
happily married. Really boring in that regard in my life. I don't know. How do you have time? That's the thing that gets me is like I've heard of like there were people in my family, businesses or whatever, and you have like stuff just comes up where you're like, I'm like doing stuff all day. Like I imagine that this is a time consuming thing. Like, how are you this duplicitous? And like I just like I don't have time for lunch,
Yeah.
I'm a social worker.
Exactly.
What do you like
It's
going
like
on dates with 10 people? Like, how do you do that?
I've made that. This is a little too much, but I made that joke with my wife several times 5 years ago. She's just like, "Are you sure you're not? Are you sure you're here? You're only for me." I was like, "I don't have enough energy for you."
Well, I mean, I should probably figure out what Andrew Huberman actually did before I talk about it.
Oh yeah, what if we're?
Yeah, but like, I mean, I think that was that he just had like a bunch of girlfriends or something. But it was like, I really don't understand how I've got 2 kids. Like I have a wife, or we have a cat box to empty. We have a, fish to feed. Like how do you do that? Like there was a guy when I worked with people that were treatment resistant, like schizophrenia. There was a guy that he would have a good relationship with you, and then 5 or 6 weeks in, he would go through every case manager because he would start to get paranoid, and he would be like, well, you came and we brought the food and you gave it to me, and that was very nice. But I heard when you were going to your car that you like quickly looked over your shoulder and you said, you know, butthole. And that was about me. And I know that they are getting to you now and making you do this or whatever. And so I'd worked with him for a while, and they were like, just be aware. I was like the only one that worked with him for like more than a year, but we were like, just be aware, he's going to start doing this thing. And I came in the door at some point, and Violet had just been born, and like, I looked terrible. And he was telling me about how he knew the CIA was like giving me orders or something. And it's like, dude, I have a newborn baby. Look at my eyes. Look at these bags. I walked out of the house without shoes on today. I'm not wearing a belt. And he was like, oh, okay, yeah, you're right. No, it's like, I don't have time to be running the world. Like he was like, he like looked
grounded
at
him.
me, and I looked terrible enough that he became not paranoid.
You grounded him to where he was. He's like, oh shit, he's right. This guy's off.
Yeah, the CIA doesn't hire people that look like this.
Yeah.
This guy looks awful.
This guy came off the street.
Yeah. Well, I don't know. Yeah, but I think like part of the thing with the podcast was like I wanted to be able to get like people who were smarter than me to talk about how there's inherent psychology and all these things like cult and architecture, and then it isn't just kind of like we go to therapy to do the psychology, but then we pretend it's not real when we're doing the rest of our life. I think is a lot of the problem that I'm trying to with therapy point out we shouldn't do. Like, that psychology is a part of us, and like kind of learning to hold that is a I don't know. I would like to change the way that we think about it.
Oh yeah, I think we do need to change. I mean, I think that's a given right now, is we do need to kind of change the way that we think about a lot of things, and bring young back.
Well, oh yeah. Some of it, some of the Jungian stuff. I mean, the problem with that kind of psychology is because I like Jung a lot, but it's like what you're doing is saying that we're only half empirical, that the other half is subjective, and that you can sort of have best practices for dealing with that, but you can't quite have rules and measurable objectives because you can't see it. There is this subjective thing that like you have to just at some point make a jump that somebody can know that another person is having an emotion and feel what they're doing and read them, and they don't need 50 screeners for anxiety. Maybe we should just hire people that sort of know if someone else has anxiety that they're talking to, in the field. But when you have something that's half empirical and half subjective, it's inherently ripe for kind of abuse by nefarious parties because you can't prove it, and a lot of the things that I think that's the Rudolf Steiner thing. Is like a lot of the stuff that we're the most insecure about as a society is some of the most important, but it's not measurable and it's not visible. And because we can't represent it objectively, we tend to neglect it kind of,
Yeah. I mean, that's a good point, especially to like spirituality, right? And that being part of a person, how do you, someone comes in and they're saying, I'm wrestling with this. I'm wrestling with being a being here and a being elsewhere. It's like, how do you tell somebody, oh, your spirit looks pretty good,
Yeah. Yeah. Well, yeah, and that'd be a fun one. I'd like to do another episode with Alice where we just kind of like roundtable talk about spirituality from different perspectives.
Yeah.
Because I mean, the thing is like, I would talk about spirituality a lot in therapy with people who are atheists. And I'm just like, yeah, like the purpose of your life and the greater energy when you feel your intuition. And, but I hear so many therapists say like, oh, well, you can't talk about that because I don't know if they believe what I believe. And it's like most people probably know people believe what I believe. Like why would you assume that you would need to, like you don't need to try and tell the patient that their spirituality is bad or hit it with a newspaper or that they need to convert to another religion, but it's fine to just be like, some people are going to very naturalistic in their language, they're going to say like, I feel the presence of Jesus. I feel held. I feel good. That's a good thing, Yeah. Other people are going to say, I went and I grounded and I talked to the earth and it, whatever. I don't need to jump in and say, whoa. What do you mean? How much of that is empirical? Let's go ahead and list all of your assumptions there. Like, why can't I talk about that with somebody, even if, like I am agreeing with them that that's their experience and that's like a good thing. And these parts may not be the right maybe trying to solve like your tax returns with spirituality is not great. You can wave the amethyst at the IRS, but I don't think they're going to go away. So maybe let's put spirituality in this sector of your life. Um, you know,
That single man, yeah.
yeah. So I mean, maybe I'm missing a gene, but I just hear that over and over where people are like, "Well, you don't know what they believe religiously, or they don't know, so I can't talk about it." It's like, why would you not talk about it? I don't get it.
Yeah, that's still part of the person that we're talking to right now. Like,
Yeah, yeah, and I think we can understand each other's like humanity, but we don't have to understand every person's exactly unique perspective. Like we, to a certain extent, we can't. I don't
yeah,
know. Well, I really appreciate your time. I don't want to run too much over. You'll have to shut me up on these. Like I need like you'll need a cane.
yeah, good. Whack.
Yeah, or maybe I
Done.
should just have we should have a cough button, but it's y'all's, so you can just hit it. To mute my mic when. Um,
Ah,
but yeah, this is great. We'll get it out, and then if you have any other topics or anything that'd be fun, let's try and do one of these more frequent.
definitely. We'll see how yeah, especially after brain spotting, just see kind of how that we can incorporate that and talk about that. So
Well, thanks, man. We will get together with you and talk again soon.
Somebody call.
Well, that sounds great, man. We will follow up with you soon.